So just to introduce myself, Rick LaLiberty again. This is the Northwest Communities. This is a community update on COVID and community safety, January 10th, 2024. And we got Candace Paul, Dr. Sobel, Dr. David Poon, Chris LaFontaine, and Dr. McKinney. So glad you guys joined us. And Dr. Sobel was first on the line here today, so I'm anxious to hear his report. And Happy New Year to you all, of course. But Dr. Sobel, if there's anything that you would like to share with us, we have somebody else joining us, a Georgina P. Georgina,
Thank you so much for joining us.
Georgina, good day. Itlanite.
I
Georgina,
believe, yes, from Lalash.
Okay. Thank you, Georgina, for joining us. We're just going to go ahead with Dr. Sobel's report. Let's see what he has for us this year.
well, so far the year has started off well. We had a team meeting this morning and it was very quiet. All the nurses were saying that things were under control and certainly a lot less stressful than it was during the height of the COVID pandemic. In terms of, Rick, you mentioned families. My sister lives in Israel near the Lebanese border, and for weeks she's just been hearing explosions going off, and she's not very calm because nobody knows if and when Hezbollah will start really sending more weapons and weaponry over to the north of Israel. So that's a concern that all of our family has at the moment. It's 2023 has not been a good year for public health emergency known as conflict. I gave a presentation last Friday to the residents on environmental health emergencies. There's a report by the WHO on environmental health emergencies. And interestingly enough, they spoke about the fact that a Medicare system is a way to try to do better preparation for environmental emergencies. I thought that was an interesting comment that they put in their report. And also the Chief Public Health Officer of Canada in her 2023 report emphasized emergency preparedness as well. And we spoke at that point because the Chief Medical Health Officer was on the presentation or was listening to the presentation. And I'm hoping that someday soon we'll get some tabletop exercises because since I've been here, we haven't had any of them, and they're really helpful when there are emergencies, whether it's a flood or a fire or some ice storm or something like that. To have done a tabletop exercise in which you're put through a scenario, everybody has to think about what their role is and who they're working with and how to best carry out whatever operations are needed. Is really helpful. So I'm hoping we'll have some tabletop exercises. And other than that, other than the fact that there are new variants which are of COVID, which are becoming dominant, at least in our area, we haven't seen that yet. And as I said, we've had a quiet time here. There are no outbreaks at the moment. I know there are many outbreaks in other parts of the province. So far, so good. I think maybe it's just too cold. The virus has run away. And that's my report for now. Thank you. Oh, I should say one other thing. I won't be with you next week, and please pray for me because I'll be suffering the weather conditions in Mexico.
Okay, we'll definitely
Dr. Sobel.
we'll definitely be thinking about you. Thank you, Georgina, for joining us. Awesome to see you, and Happy New Year from all of us.
Yes, Happy New Year. And Dr. Sobel, you still have your touch of great sense of humor. And I decided to come back to you guys. Thank you for the invite.
Well, it's been a while. It's lovely to see you. And in fact, I've hardly ever seen you. I've just heard your voice.
Oh, there you go, Dr. Sobel. But you got to think of us when you're in Mexico.
Okay, send me a snapshot.
Ah, you're a joy to listen to.
Well, from Dr. Sobel, we'll go to his colleague and his partner over here, Dr. David Poon. So Dr. David, if you don't mind giving us an update on what you have and what you're looking forward to in this new year.
Well, first, thank you, Mayor Georgina, for coming. I recently got to connect with her because we had a media request from the SHA to talk to the Meadow Lake reporter about, and this was their exact question, why are there so many dog bites in La Loche? And so Rick had given me Georgina's number, and we were able to connect, and I spoke to her colleague, Leanne, who is doing fantastic work about doing their best to prevent the number of we'll talk wild dogs happening in La Loche. So this is the situation as I understand it, and I realize Georgina will be able to talk to it further. But there is, according to our epidemiologist, a significant number of wild dog bites occurring in northern Saskatchewan, and much of it is centered in La Loche. I do not want to identify particular places, but Losh has a number of wild dogs. It is so high, the proportion is in excess of half the number of dog bites in the north occurring in La Loche. There is a community-led initiative. They have a La Paz protection group, which is volunteer-run. There are no consistent sources of funding for the shelters. And in addition to that, the university used to bring in vets to spay the dogs who are in the area, but that no longer is occurring. Lastly, there is no bylaw officer to enforce the existing bylaws that are meant to prevent the further proliferation of wild dogs. So there's the immediate and more long-term issues. Number one, the immediate is I've asked the mayor and deputy mayor for their thoughts on how to present this to the SHA media. We'll create a response that is acceptable to the community, but also is very stern in the need for addressing this issue. We will not be focusing on rabies because rabies is not a pertinent issue with the wild dog bites in the north. However, we'll be focusing on the number of bites, the fact that there's schools, and the fact that there's a high number of bites because there's no consistent funding to support. Following that, I hope we can continue to work with the communities, including the Losh La Paz program, as well as the other communities in the north that have high rates of bites, to find a sustainable solution in addressing this. And that might start with us advocating to the university to resend their veterinary students to spay, and eventually figuring out a manner in which the municipalities, the governments, and our health can get a bylaw officer there. If I were to just spitball what public health could do, we could declare it a public health issue and actually have public health inspectors manage that the same way that masking became something. But that is a very strong approach to do so. So right now, well, first step is respond to the SHA media request from Meadow Lake reporter, and then continue to have the conversations and build a possible longer term solution. I was able to speak with Robert's colleague from the radio show. We've been meeting weekly, which is really nice, for about half an hour talking about various topics. Last week was on addictions and mental health. This week we talked about heart health, and we're hoping to have better engagement from the community. It's my understanding that soon enough, Robert will have call-ins and some way to better interact. I've been leaving my email on these discussions, as well as talking about this very Wednesday afternoon session, hopefully to encourage further people to come, to interact, and to grow, because having that community engagement is significant. In terms of procedural items, there is still no easy way to click a button and notify every single healthcare person in the North. So right now, every single healthcare worker in the North, and so I'm working on building that list. In terms of issues such as departmental communication, when we first met, we talked about whether or not we could get access on traumatizing items like dismemberment, anxiety, depression. And in this new year, Udoka and I will be approaching this again with Neetha to find a way that shows our respect and our want to help the community. Because at the moment, I think perhaps because for various reasons, Neetha has yet to be able to bring us this information. But we have not forgotten your requests for the mental health data, including dismemberment and violence related items. And that's something that we want to be able to focus on in the new year. Otherwise, I'm grateful always to be here. And thank you again for joining us, Georgina.
Thank you. I appreciate that.
Thank you, Dr. David.
I've got a question. I've heard a rumor, Georgina, that you have a new line of perfume out that smells like raw meat. And is that contributing to the dog bite situation?
I've become really good friends with the dogs. I don't have any issues with them. Because what I done is I start feeding them so they know who I am, and they come looking for me, and they sit by my truck. And when I'm walking, they come walk with me. So yeah.
Yeah, just recalling before the pandemic, when we were starting to meet with the MHOs, Rim Zayed was the MHO at the time, had reported that she had to drop the agenda of the dog population in La Loche. She was starting to deal with it, but the pandemic took it over. So she that issue has been around for a while, and there's some other communities as well, probably the First Nations ones. The Sandy Bay I know was bad, and I assume Pelican as well. I'm not sure, but I'm not sure if Neetha would report on those, but maybe that's another strategy, is to unify either a mobile unit that does it as we did before, but maybe that's something you could strategize with Dr. David is talking to Neetha. Maybe that, we could collaborate with them on addressing this issue. Just wanted to bring that up as part of the historical reports we've had before, but just to
Can I
moving
just ask
along,
a question of
yeah, go
David?
ahead.
You referenced a report where you're trying to act on a particular issue that's identified. Is that report public? Like, could we get the top 10 issues so we can begin to see the trends over the last year?
Thank you for your question, Chris. When I first started to come to these meetings, Candice, Rick, and some community members that I got to know asked for various different mental health data. Udoka here is essentially working with Northern Medical Services to help find this information. The data itself, we aren't sure, but we believe is being held by Neetha. We have to ask them to give us that data so we can process it and clean it. They have not given it to us yet. So no, nothing's published. We aren't even sure if it's collected. We're pretty sure it's collected, and we're pretty sure it's in Neetha's hands. But until we are able to build that relationship where they're willing to give it to us, we have been unable to collect it. But Chris, if you have questions about what data you want us to collect, please let us know, and then we can work on getting that data.
Chris, you're muted.
Yeah.
I'm just thinking about issues. Everybody thinks that all health issues will be solved by the health people. But you look at dog bites, that becomes a health issue, but there are things that the communities could actually do. And as I've been looking at the whole idea of addictions as an example, everybody treats addictions as if that going to a medical practitioner, clinician of some sort, they could solve that. But a lot of the addictions type of issues are in family problems. They are in different types of other types of groups that are actually mandated or have a mandate or doing something about it. And that's what I want to be able to understand is who else is being engaged. I know mental health, I know, Veronica's doing things, doctors, nurses, SHA, but very little engagement is actually dealt with. With allied health, very little engagement is done by other groups, like the treatment centers, for example, which we talked about in December. I mean, just those problems. And I think that if we could be helpful, we could collect some of this, and just as Rick is taping this, that it could be put out to radio stations or podcasts or whatever, so people can begin to understand that health, don't always look to the health groups to solve health problems. There are root causes, and I think those things need to be considered.
If I could comment on that, yeah, one of the issues that medical health officers are dealing with in Saskatchewan is that there seems to be no incentive or current interest in our government to look at those root causes. And medical health officers have been very concerned because a lot of our discipline is meant to be relating to the root causes of problems rather than just treating problems after they've occurred. And I'm going to step away just a second because although I've read it before, I'm taking to Mexico this book called Introduction to Determinants of First Nations, Inuit, and Métis Peoples' Health in Canada. And that, speaks about these root causes, starting with Europeans coming to North America. So, that's an area that I think would go a long way to, try to stem the current problems. But this current administration in health in Saskatchewan just seems to be focused so much on individual care that the whole essence of public health is pretty much ignored. So I keep trying to bring this issue up, and I'll keep doing so because I feel like our professional mandate is being restricted. And that's really a tough thing to take when you know that there are areas that we really need to work on that are being ignored. Thanks.
Okay,
Can
thank
I
you.
say something?
Yeah, go ahead, Georgina.
The challenge with the municipality, what Dr. Sobel said, even from the health perspective, the provincial government is not really too keen. It's not really too keen on giving support or getting behind it. The challenge with the municipality is that the municipality, we have no resources, absolutely no resources. The challenge, the dog population in the community, we, the community have been trying to tackle the issue. The lack of financial resources and the lack of support from everywhere else has made it really difficult. In terms of even acquiring a dog, I know this is not a pretty thing to shoot dogs, even to attract the dog shooter. No one has been coming forward to assist. And the LA Paw Protection Board that we have, Amanda is doing a remarkable job. That's her passion. And she does an excellent job in feeding the dogs and getting the dog food and everything that she does. But when it comes to the other resources, we don't have. The village does not have the capacity. And it is extremely challenging. And this issue, we know it's really bad because the dog population is really huge. somebody has to help more in the province. I'm getting frustrated with the province. They don't really help in trying to help solve these very issues that we want to solve. But thank you for trying. Maybe the province will begin to support with the support of the medical health officers.
Thank you for trusting us. I emailed Leanne, the deputy mayor, and the LaPA program a draft of how we want to respond to the request. I'm hoping that Leanne will speak with me to the media so we can bring some highlight to it, and then we'll figure out which levers. I just need her and your consent. Okay. I would like you to take a look at what I've written to make sure it's appropriate for the community.
Yeah, I just
Question,
wanted
where are you sending it to?
I sent it to Leanne yesterday. I'll forward it to you right now.
Okay, you have my email address? I have a new email address
Oh, what is your new email address?
because I have a new employment too. Jolibois, JOLIB as in Bob, OIS as in Sam, G as in Georgina, at SIIT.ca.
I'm sending you a blank email right now. Please respond to let me know it's correct, and then I'll forward you what I sent to Leanne yesterday. Thank you.
I'll do that.
Thank you.
One of
Yeah, I
the
just want-
challenges that I just like to put out to people when it comes to dogs, who's responsible for the dogs? If I buy a dog, who's responsible? It's me
Well-
as the owner. And the challenge that you run into is when I don't take my responsibility as an owner, then it creates a community problem, which creates a medical problem, which creates. And I think at some point in time, if you're going to do something, Dr. Poon, I think you need to begin to identify who's actually responsible for it. Because right now, I don't have to look after my dog. Somebody else feeds it, somebody else looks after it. If it gets sick, somebody else provides it veterinary care and everything like this. I appreciate that, but it's creating a situation where I have a mandate that I'm not responsible for. If there was, if you're in Polynesia, my wife is a Polynesian, every time they see the dog, they see lunch. And so as a direct result of that, all we got to do is go find 10 or 15 Polynesians, move them up to Lalash, and you'll have you'll have no problem whatsoever. But I may say that in jest, but at some point in time, we've got to be taking responsibility and encouraging people that have those love of dogs to do something about it. And I know that I've talked to Georgina about that lots, but the idea, it's not the town's responsibility to actually look after the dogs. And so it's organizing those people that have the dogs to deal with it.
Yeah, I was just
I wrote my response in the chat. My apology.
I was just going to say, you know, the measures that you're contemplating, Dr. David, I think just go ahead and do them because the province is not giving the resources to municipalities. Down south, my in-laws lost a dog in the city of Prince Albert, and a bylaw officer from the rural municipality brought him in. So you have bylaw enforcers down south. That's the process in this province. If there's wild dogs available, you know, the ownership is not there. They're beyond ownership now. These guys are living off the streets. And to control them, that's where the municipality kicks in. And that's where the bylaw enforcement is needed. But there's no tax levy, there's no revenue for this. And as Georgina said, you know, it's hard to employ somebody on a small contract to try and kill dogs and then to live with the stigma of being the dog killer in your community. So sometimes a mobile regional, response might be required, but the province has to provide resources for these municipalities to control this, because it's beyond dog ownership, Chris. Some of these dogs just live off the streets. It's not anybody, they have a home, they're homeless. And but the resources to address the overpopulation is not there. And that's where Georgina's their big problem here. Same thing in our community. It happens in cycles. Beauval, same thing. We'll get an overpopulation of these dogs, and then to try and find somebody that'll manage them, sometimes you got to go out of town to 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 sidestep that stigma.
So it's
Okay,
a
well, let's move
progression.
along. I was just going to say, Dr. McKinney, I don't want to hold you back. We're still reporting, but the dog issue, if we keep it on the agenda and then keep an update on it, I think that's probably the best way. It's part of our community safety pulse here. So if there's any solutions or any support we can give La Loche, that's what we're here for. So we'll keep this agenda going, Dr. David, if you don't mind. Let's keep a report going forward on this, and if we can get more information from NIFA, we might see a northern picture as opposed to a regional picture. Dr. McKinney, 2024 is upon us.
Yep.
What do you have? What do you have on your crystal ball for our new year?
First of all, oh boy. Well, we're still struggling with a lot of the same things, as you can tell. I know they've declared COVID endemic, but it is definitely not gone anywhere. This is turning out to be one of the worst years we've had with COVID. So whatever you call it, whether you want to say endemic, pandemic, however you want to look at it, it's bad. And along with, of course, COVID are the influenza, primarily influenza A, but we are anticipating B will take a spike here as well in the not too distant future. And RSV is the other big virus, although there's a real mix of different viruses, rhinovirus, adenovirus, there's a few different things out there for sure. Some of that is related to, as we're studying more and more about COVID itself, what's coming out is that COVID affects the immune system in some ways similar to HIV. It decreases our lymphocytes, particularly things like our T cells and natural killer cells. It's a whole army, our immune system. It's actually, now this is the nerdy part of me coming out again with my medical stuff, but it's the things I love. But there's a whole army of cells that literally fight, and figure out what's going on. There's the B cells, which I describe as sort of making pictures of the bad guys, distributing that, and making sure that they're able to fight them when they see them, kind of thing, antibodies. But so clearly, COVID has a big effect on our immune systems. We don't know how long it lasts. We know that it's generally for at least 6 months is what they're finding in most people. It could be longer in other people, especially those that suffer with long COVID. But the implication of that is that when viruses are around and you've had COVID and your immune system is down, you're going to be way more prone to these other diseases. And I think back to, there was a study done, I think now it was 2 years ago, in the far north and in our northern areas. And one of the things they found is that we had increased rates of TB in children post-COVID, and we had deaths of children due to TB. Crazy, because this is an old disease and we should not be having this kind of thing, but we do. So I'm pretty confident that some of what we're seeing in all this illness is the fact that the immune systems are decreased, and so therefore people are going to be more prone to other viruses. The effect of that is that, of course, there's an overwhelming number of people that sometimes need to go to the emergency departments or be admitted to hospitals. A lot of people with this last round of viral infections seem to be getting pneumonias. And part of the symptoms of COVID right now are difficulty breathing or increased, respiratory rates. So we're seeing that the emergency departments and the hospitals are overwhelmed. I sadly just lost another patient related to COVID and pneumonia, and then, you know, intubation, and just wasn't able to come back from that. So we're seeing the increased death rate. We're not hearing about it. In fact, the reports, even at the Canadian level, are getting more and more difficult to produce because there's so little data. The testing is so minimal that people are doing. We know that the rapid antigen tests will be not be provided for in the not too distant future. I've kind of hoarded a little bit with 2 boxes of tests, more so because I think it's good to know whether or not this is COVID. But I think it's also one of those things you can do before, if you're going to go to a gathering or something, or before you go out to something. Even though I still wear a mask to everything, I still think it's good to know, because the other interesting fact is that when they've done some studies here on where you catch COVID from, 60% of people that have got COVID got it from people who were asymptomatic at the time that they transmitted it. So they become symptomatic later on, but the transmission time is before the symptoms show up. So, you know, again, it really gives you a good idea that masking is important, good air quality. And this is the other thing I should have brought my little checker, but I've got a little portable air quality checker that tells you what the CO2 level is in a room. And it is shocking to me how poor the air quality is in a large variety of places. You know, I went to the university, and there's a whole area of the health sciences that was redone. I would have thought it would have had much better air exchange, and it was actually in the severe range. So to the point where you're going to get headaches and, you know, all kinds of different consequences from having these high levels, but there's no air circulation. So I really believe another area we really need to start pushing on is air quality, improving the air quality, places like schools, places like our hospitals, so that the air quality is improved, and we're not, you know, with the stagnant air, those viruses are going to sit there for a long period of time. So, you know, that's a big area I think we need to be looking at as well too. There are still shots available for COVID and for the flu, and I still encourage people to get them. It still is protective. If you've had COVID, and unfortunately I had a COVID Christmas, my son got it and I got it. My other son didn't get it, so we're able to spare one at least. And we had the vaccine, so it wasn't as bad. But having said that, I was shocked at how bad it was. It does last for quite some time. But you know, it's still around. If you've had COVID, then you wait 6 months at least, they say, although they are talking about only doing COVID shots once a year, generally in the fall. I don't agree with that. I think you probably need to get it more frequently, especially with the mutations that we're seeing. We know that there is another mutation that's coming that seems to be quite infective as well. So we'll see with that. But also this influenza B, as I was saying, is probably going to be a bit of an issue. So if we can get people immunized, that's great. The other thing I was going to say is that you know, there are these other issues, the issues around homelessness and addictions and safety. And, you know, recently there was quite a bit of news around Edmonton and their disbursement, as they call it, of encampments for homeless people. And I just, you know, especially as the cold weather is upon us, and, you know, I just feel that we really are seeing numbers of homeless people that we've never seen before. We're seeing families that are homeless. And it seems to me that this is a really ridiculous thing. I feel like in this day and age and in our society where we have enough resources, we should be at least able to provide a basic standard for people. That does not seem to be the mandate of the government, for sure. And, you know, like I said, I think there's a lot of misunderstanding about what that is. But at the end of the day, there's, again, all kinds of studies to show that when they do this, when they provide that minimum standard, and Finland was one that came up that I was reading recently. When they did that, they actually improved the health of everybody. So as you were saying, Chris, sometimes it's not going to healthcare workers or even looking at healthcare issues to improve health. Sometimes it's often these social determinants that make a big difference. And there are things that we could probably do within communities to start looking at these types of things. another study that was done was providing people with $750 a month, homeless people, people that had nothing, and kind of following what they did. And the vast majority of them within 6 months were no longer homeless. Some were able to get jobs and such. But at the end of the day, that what it's really proving and is that most of the people are not homeless because they want to be homeless. They're not addicted because they want to be addicted, but they don't have the resources to get out of those situations. So again, those costs associated with all of those things are huge, not only to health and to the, economically, it's physically, it's emotionally and mentally. I mean, we all have family members, I'm sure, that we can relate to, or people we know or see, especially in our communities. And, that cost is huge. And we're seeing people dying that shouldn't be dying. Like it's normal, the people that I'm seeing and treating, to have people live really only to their 50s or 60s, which also then brings me to another thing. Our life expectancy is dropping significantly in Saskatchewan. It's the first time in a long time, and we have the highest drop of life expectancy in all of Canada. So again, this idea of dropping our healthcare and all these things seems to be having quite a negative effect. It's not just COVID. I would even take it a step further when we look at some of these other provinces, particularly next door in Alberta, where seems to be a real push towards privatization, and we're seeing that here too. I really fear that our North and our Indigenous populations in particular will really, really suffer, because how can people afford, privatization? There's all kinds of things that are being done where surgeries, for instance, they create lists rather than actually investing into the healthcare where they could. And then people are saying, well, I had to wait too long, just make people pay, or they want to privatize, pay private people. It's a way to privatize. So I'm very afraid of what's coming in the next year or couple years down the road, because I really feel that this is a very strong push, and we don't seem to have any pushback from community in lots of ways. We're seeing it with the education system. This is another thing. When we don't educate our kids, what chances do they have? This is another social determinant of health that's critical. So, when there's no desire to make things better, and we've seen the science and the math has all dropped actually recently in terms of testing. Not that that necessarily reflects everything, but when we're not supporting our teachers, we're not supporting our kids, man, we're in a bad situation. So I feel like there are a lot of things going on right now that are not leading to good situations. I think there's a lot of politicization of a lot of these issues. And another issue that I'll throw it at you is when there seems to be more of a push to get an MRI in the southeast part of our province. Where do we really need an MRI down there with that population? I don't know. I kind of think dialysis would be a far more important investment in the north. When people are traveling like huge distances, several times a week, and you just think of the costs and everything to the family and all those things, yet there's never really much done around these things. So the prioritization does not seem to be based on need or necessity, any of those things. I think it's very politicized. One of the areas I'm trying to work on is lab services and making use of things like point of care testing. Again, it's been a bit of a battle within the province. They kind of have their own ideas about these things, but we're looking to see what we can do. One of the problems that I also see that the province wants to do is just kind of add this to the duties of nurses or doctors. And they don't really understand how to do these and all the requirements. So that's part of what I'm working with SIIT about, is trying to develop certification programs that would be maybe a few weeks in duration, so that we can have those done by people trained and have people in the community trained. Because again, the more we can engage our community people in a variety of ways, including employment and jobs and education, I think the more the community can be will be engaged with what's going on. Right now, they're sort of kept out of the loop of everything. I am most frustrated with the SHA. They tend to go, particularly in the north, they go to the healthcare providers as the people to speak on behalf of community. They do, our community, our doctors, I mean, I don't think they're terrible people or anything, but they don't speak on behalf of the community. They don't really understand a lot of the dynamics within our communities. And I really feel that that is a huge mistake. And again, it seems to leave out our community people from speaking on their own behalf. And so again, these are things that we're trying to work on and advocate for and bring to people's attention. I will be heading to Toronto in about a week or so, I think it is, to talk about there's a roundtable around equitable access to services. And so I've been asked to, to cancer diagnoses in Canada. So I've been asked to be part of a roundtable on this. So I will certainly bring our concerns forward around that. But if there's anything that people wanted to bring forward, please feel free. And as the new year starts, I wanted to put out to the group, are there things that we could be doing to facilitate things, like in terms of communication? Dr. Poon has been doing a great job in terms of some of the radio spots, as has Isaac. They're doing education. They're doing research along with Udoka. Like there's lots that they're doing. But I think, again, Chris, you were right. You hit the nail on the head. We need to get this information in a useful way to our community people so that we can work together to try to use that in a good way. I always think of the TP teachings in my training or knowledge is around the TP teachings. Out east, they call it the great law of peace. But one of the big teachings is that we need the right people at the table, the right knowledge. We need all these things. But all of our decisions have to be made based on what's in the best interest of community, not in individual interest, but more around community. And I think that's how we will continue to move forward. And I see that that's how things are being done for sure. And the only other thing I think I wanted to mention was, there's two other things in terms of Northern Medical Services. So in La Loche in April, we are supposed to be taking over the clinic there. So we've always had our doctors there. We've hired some medical office assistants just to kind of help. We've never had enough to really run a clinic in an appropriate way. So we are working with the SHA on that. I think the challenge is going to be, we just don't have a big enough space. Back before I ever started, we didn't have enough space. When you start adding in, like we've got not only physicians, and we have 4 doctors, we're going to have 4 doctors on the ground at all times is the goal. You've got nurse practitioners, we bring in specialists. We've actually increased the remote ultrasound that we're doing there now to 2 half days a week. Which has worked out really well. It really means that people are getting their ultrasounds done right in community, and that's really pretty fantastic. But there's more that we could be doing, and I'd really like to get some of this stuff going, but I need space to do that. And it's just like pulling teeth trying to get space so that we can have adequate space so we can actually have places to work. When you don't even have enough exam rooms for the amount of people that you have, it's just not feasible. In Isle, we are running into a challenge with, some of the back push and pull with the physicians. They all have their own personalities, and it's making it so that the people that we bring in as we always bring people in to try things out for a couple of weeks, and we usually do that about 2 or 3 times before we sign them on. It gives the community an opportunity to see what that physician is like, and it gives the group a chance to see what that physician is like, and it gives the physician trying it out a chance to see if this is something that would fit. But unfortunately, our group out of Isle seems to be running people out of town these days rather than bringing them on board and then turning around and saying, well, you guys aren't getting anybody to fill in positions. So I encourage community to also have a chance to see. We usually consult with town villages, with the formal governance to try to see what people's input is. But it's hard because I know not everybody in the community would have a chance to meet with that one physician or not. But if there's better ways that we can do that, or kind of introduce our newer physicians into community, I think that would be really, really helpful, so that there's a better sense of what's going on and how they might connect in a meaningful way with community. Because to me, I find the more that we can connect people with community, the more it actually helps them to understand and get to know the people. But it also engages them, because most people, like, I love you guys, and I know that people fall in love with the people, right? And that's what's going to keep them in our communities, and that's what we want. So even when people often have to work what we call itinerantly, meaning a couple weeks in, a couple weeks out, we've had people that do that for many, many years because they love coming back to community. Their partners are away, or they maybe their kids need certain service, whatever it is, the reason why they can't live permanently in the community. They still want to come back and forth. And I think Dr. Poon's a great example of that I really feel there's a strong commitment to our community, but sometimes we have to be able to make use of some of these different things. So lots going on. I think there's lots of opportunity that we would have to make things in the way that would be the most effective for community. And I really, my goal this year is to try to get things a little bit better organized, so we get those opportunities to talk and really have community directing us in a more robust way, I guess is the way I would put it. So that's my multi-pronged report on everything on the state of affairs, which is not good, unfortunately, but that's where we're at.
No, when you mentioned COVID Christmas, there was a report here from our neighbors. They had a family gathering, and most of the family got COVID after they left, but all different symptoms. Yeah, it was a variety of symptoms but when they got tested, they were all carrying COVID. But luckily, the two elders that were there must have got vaccinated, but they didn't get it. So it was a blessing in that way. But a family gathering, just multiple households coming together. They all went back to their households, and they had COVID with different symptoms. So it's a confusing symptom to put your finger on it unless you get tested. That's the only time they found out.
Yeah, well, and that's just it. It's hard to tell the difference between that and anything else. And like you said, it's different symptoms in different people. But we know, again, like I said, it's actually not a respiratory illness, even though you might get the symptoms initially of that. It affects the lining of the blood vessels. So down the road, we still don't know what the effects are. Another study I read was that it can add 20 years to your brain detriment, I guess, like, so that it's like you've aged 20 years based on what COVID does to the brain. So, I mean, there's a lot of stuff that it can do. The more you get it, the more often you get it, the more likely you're going to get some of these effects down the road. So very concerning to me.
Thank you, Dr. McKinney. Candace, we'll roll you in here because you kind of give a pulse on NETHA, so that's kind of
Well, yeah, I'm not sure if NETHA is really taking mental health statistics. I really don't know. But I know, like, in communities like English River, we are, and we're working with Dr. Chad Nelson to, like, we've had an intervention circle going for nearly, oh God, before I even started working with them. So I'm on 4th year, and I'm sharing those meetings most of the time. And so we have a database of what mental health addictions, child family services stuff we're dealing with in the community. And then we're using that to assign people to cases so that they're getting support and follow up. And so we do that on a weekly basis. So that's the kind of data we're gathering, and we've been gathering it to actually justify getting more mental health workers, more Jordan's principal workers, that sort of thing. Something I see as another gap is, let's see, group homes or something suitable for, kid. Like, we had one kid here attempt suicide 3 times in a week and was sent to Isla Cross Hospital and released. Sent to Isla Cross Hospital. 3rd time, they finally sent her to North Battleford, but they've released her again. And, I don't think her issues are being dealt with. I mean, our mental health worker is on it. We're trying to find, a stable situation for her to start to deal with this. But there's There was nothing. And Meadow Lake Tribal Council knew of no place to help her. Strongest Families I brought up to see if, you know, like they could connect with the whole family, because obviously there's a problem there. But you know, that kind of thing, if year old refusing to live at home, what can be done? Because she needed to be watched, you know, like we need something. We need to fill these gaps in our communities. And yes, it's not completely up to the healthcare system. We have to start creating these things ourselves. We have to find those resources. We have to find the money. And then we have to find the money to pay people to work effectively. So, you know, that's part of it. As far as COVID goes, there's a lot of COVID in Pachinak. I know it's been going through here too. But I know the vaccination rates in Pachinak have been down, but you know, it doesn't seem to people are saying they're still getting sick and sick, quite sick. So they're wondering, well, you know, how effective is this? Like maybe we don't know if we're seeing long COVID, because you can, like you just mentioned, you can get all of that in that immunity situation. I see that a lot too with a lot of people. They're getting everything. So it's, you know, and there's really no medications, there's no stuff that works, and without the testing, like Neetha isn't going to be getting any more rapid antigen tests, and all of ours are expiring next month. So, you know, it's nobody's going to know whether they had COVID, and I think that's terrible going forward when you start to experience other health issues that would be, you know, initiated by the COVID. So you will never know whether, you know, you had the COVID and whether that's caused all these problems in your future. That's irresponsible, basically. And you know, like I said, with the vaccination part, I don't know if there's been an increase in people trying to get vaccinated, but when they're vaccinated and they're still getting sick, that just brings them to question the effectiveness of the vaccine. So anyway, other than that, as far as the dog issue, English River in Pachinak is another place that has a lot of issues with dogs. And I know that the cost of getting animals fixed is a deterrent to people taking that. I know during the time we were also, and the cost of dog food now, like, and then if you can't get your dog fixed, and you end up with 6 dogs instead of 1 dog, you can't afford the dog food. So they start to go into the people's garbages. Well, we didn't have any of those problems during the evacuations because we were providing dog food and feeding all the dogs. And there was no more dog fights. And the dogs were staying in their yards. So, you know, I think we need to do something about having veterinarians at an affordable cost. Because having a dog in the north, I find it essential. Having more than 1 dog sometimes is essential. I know I always have to have 2 because they have to back each other up with the wolves and the coyotes that are in the communities right now. And we're seeing a lot of that right now because of all the fires having taken out a lot of the food that they eat. So I've had people calling me about that being an issue, an emergency issue. And to me, it's not an emergency issue. That will help actually take out a lot of puppies and a lot of sick dogs. And issue as well, and then I'll move on. But the fear mongering against wolves and so forth, I'm not going to make that an issue for people. We do live on the fringe of the forest, always have. They've always been there. So it's up to us to live responsibly with them. And that's about it from my perspective. We are getting our Jordan's Principal teams up and running. We had them in the past before COVID, and we're getting them up and running again. And English River opened another youth center just before Christmas. So we're doing quite, other than that, like we ran our whole program over the holidays. We had on-call workers, and I was dispatched for all on-call, and I only had a handful of calls. Most of the calls were maintenance. So we did actually have pretty good, and in the intervention meeting this morning, we only had 3 new cases of people needing mental health or family or addiction support. So that wasn't too bad. We also had hired security over the holidays and that made difference in the community as well. And we're looking at extending that because our communities are going to be getting Cows and Plows funds really soon. And we're anticipating that big influx of money is going to create some issues for us. So that's about it.
Thank you, Candace. As Dr. Sobel reported on the outtake here when we started, emergency preparedness is going to be critical. And I think with the fall, with the way the fall moisture level is right now and the winter snowpack here, we're looking at a very dry spring. So in emergency preparedness, maybe Georgina, is there any help you need in that area? Or what do you see in preparing our communities for our municipalities? What do you see in the emergency preparedness side coming up this spring with potential wildfire and habitation, relocation, all the community
what?
leadership? The community leadership always has to deal with this stuff. So we'll call upon you to put your perspective on.
When we have a tragedy, when we have the incidents of the fire and we have to evacuate, the provincial policies don't pay for it. The provincial policies is a hindrance to making sure that people can evacuate. If people really have to evacuate, they're literally having to go on their own without financial resources. So my biggest fear is when the fires are coming to the community and a massive evacuation, like it did in territories. And then many people, the majority of them will say, no, I'm not going anywhere because I don't have money. I can't afford it. And they're correct. And so the provincial policies make it really difficult to even want to be as prepared as you can, because the problem, I remember going through the examples in May, the provincial public safety person said to us, as soon as you declare and evacuate an emergency, we will cover the costs. That was further from the truth. And the rules and what they were expecting, people said, no, forget this. I'm not going anywhere because I don't have the money to go do this. So, and it makes it really difficult because to find the again, municipalities on the hook, and municipality don't have the resources, and people are gonna say, the heck with it. If I'm gonna die, I'm gonna die. Elders will say that because they've
we had that issue with some of our urban members that lived in communities like across Buffalo Narrows, and they were stuck. Like they were really stuck. Like some of them just ended up driving through the flames to go back to their home community of Isla Crosse because they couldn't cope. There was no food. There was no provision for shelter. The only way they could get that is if they got on the bus. And I was gonna ask Georgina, like, is the government doing anything like, putting in fire guards and stuff like that for you guys?
The fire guards, yeah, we have to be careful though. If the municipality, um, if the municipality declares, then the cost is on the municipality, and the municipality has absolutely no resources. So we hope that we have an understanding. We have an understanding government employee within public safety who would be helpful. So the answer is, as a municipality, the government's offloading everything to the municipality, but we have no resources, so we're none the wiser.
Georgina, any reports on the COVID situation in your community? What do you see in that area happening now?
Since Jennifer left, Saskatchewan Health Authority, we don't know who they are anymore. So we don't have any reports, nothing to report.
Wow.
Yeah.
Yeah, Jennifer was a great source of information and throughout our pandemic, was always loyal to giving us a report. And in her absence, she would assign somebody. But now with a new person in place, SHA has evaporated here.
So it makes me nervous for come spring and summer. It's
Yeah, I would agree with you, Georgina. Like, we have tried to get hold of people. I mean, Deanna's still there, but to be clear, they haven't filled Jennifer's position. They just have the guy that's working out of North Battleford and covering mental health, and North Battleford is now extended into, and I don't see any change to that anytime soon. So that to me speaks volumes as well in terms of what they understand, what SHA understands the need is in the north. It's not necessarily like Deanna or Chad, I think the guy's name is, but it's at a higher level and a provincial level. So again, this is where I actually think we need to be screaming bloody murder to say, like, this is ridiculous. We are not getting our needs met by any stretch of the imagination. Again, I feel almost militant, like we need to come up with our own health authority, either, like the First Nations Health Authority for the North, and like something, I don't know what it would be, but I just really feel like there's not an understanding at all of the North.
You know what I think it is that, yeah, we have an MLA with the government, but based on my observations and my discussions, municipality leadership is not willing to speak up against the government because they are reprimanded. This provincial government, on every ministry, they have made so many rules. If you break one rule, you're non-compliant. And so that's how municipalities are. And then when expectations come out and then they say, look at the emergency preparedness, to community safety, to other avenues, is that the municipality is responsible. But hello, how the heck are we going to be responsible when we have no resources? So that's been the experiences that I've been having these last few years over here.
No, I don't see any relief in sight coming, but if there's any way we can help, Georgina, we're just a phone call away if there's anything in the immediate. And the health issue, I think you're right. The northern leaders need to get our community's vision together, what we all want to see. And if it goes beyond into a First Nation leadership as well, I think it's high time we start coming together as a northern community, not just a jurisdictional community. I think the health needs are in there, also education, employment, as you said. A lot of these social determinants could be addressed at the regional level, you know, collectively, because we're all in the same boat.
Mm-hmm.
And the threats are the same. Like the boreal forest is all around us. The resource development is all around us. It's happening all at once. The crown land sales are all happening around us. These are going to be big impacts for us in the future, but the services and the capacity building is just not there. It's diminished. I think they've rolled back a lot of the capabilities of the North. Georgina, if there's anything else?
I don't, no, I don't have anything else. The municipality, because of no resources, we've been pretty, and that's it. We haven't been doing a whole lot of anything. Hard to do anything without the support.
Well, as far as space, I think your strategy would have been the old Ducharme school that will be available to you in about a year's time. I think the new school is on schedule, is what I've heard. But
Again, you have to understand that the village is expected. Yeah, the building will go to the village, but again, the village is expected to come up with the resources to look after the building and to figure that out, and we're not even near that. A new economic development board is starting up, and I hope that they come up with a plan to make it work. You can't really do anything without the financial resources.
right. Well, I don't know if you've met Dr. Udoka. I'm going to bring him on here next. He's been our research, I guess, liaison, advisor, listener. But Dr. Udoka, meet our mayor from La Loche, Georgina Jolibois.
It's a pleasure
and
to meet you, Georgina.
if you have any questions or any ideas on how to go with things or where you're at with your research, you go ahead.
Sure. Yeah, thank you very much, Rick. Nice to meet you, Georgina. My name is Udoka. I am a first-generation settler here, originally from Nigeria, and I have a keen interest in indigenous research and working with communities to enhance strategies that benefit them. It's also I'm also grateful that you attended and listening to your stories. I was wondering if it would be okay that I introduce you to a concept that we are currently that is currently unfolding, and Dr. McKinney is aware of that. In our meetings, we've been talking about data and access to data and using data-informed strategies to inform some of the issues that come up in our meetings. So there is an idea that already exists in other provinces where data is extracted from EMRs for patients, and the data is used to is analyzed and used to inform strategies for communities. But then the communities are in charge of their data. I've been talking about indigenous data sovereignty here, and so it's an unfolding, ongoing process that is just gaining some kind of momentum in the province, and if it's something that I'm sure will be very beneficial to the communities, I could discuss it further with you, Georgina, and we could talk more about it. But I was.
With all due respect,
yeah,
the village does not have the capacity to even have the discussion and to sort through it, not for a while. Because it's, for us, even though we get the statistics, it doesn't mean anything because we don't have the other resources to do anything anyways. And so it's a frustrating process.
I totally understand, and I hear you too, because it's something that we've that has come up in our conversations here. But it's still an issue that we could work together to inform. Either way, just like Chris said, not everything has to be a health issue that we solved by a health person. Most of it is community based, and we've talked about um, engaging communities to address their own issues themselves. So if that's something that we could,
No, I'm going to stop that. Not being not being rude or anything. I don't think ministries and different departments are listening. Those very words don't help us because again, I don't have the resources. The municipality has no resources. Great idea from your angle, but for us here, people are really frustrated and people are saying, because there's been that approach doesn't really, that's where the communities are at. So it will take, I don't know what it will take. I don't know how to get back onto the, what you're saying, like you have a great idea. What you're wanting to offer is a great idea, but it won't help us to start from scratch because I don't have that, we don't have that capacity to even run with it. My apologies.
no, that's okay. I appreciate your time and your response as well. And I'm happy to offer my services and my time to whatever capacities that you're willing to pursue moving forward from any side of research or any side of community building and all that. Yeah.
Yes, for sure.
I was also going to ask Candice, or she just stood up. Well, anyway, I can ask you, Rick, is there a way or is there any connection to a the health center in Buval that you could link me to? Because this is also going to help the work that I'm doing with David and Isaac on that NISA front. So we want to hopefully engage them or introduce them to this concept of extracting data from the EMRs. I'm currently working with some physicians at L'Orange to figure out how we could clean some of the EMR data that we have so that we can return it back to the community at some point and use that to address some of the concerns that constantly come up from the community. Is there any person you know in Boval that is in charge of the health center there? That's my question.
Actually, Idoka, you're gonna have to go through SHA. That'd be Deanna that you'd have to go through.
Deanna?
Yeah, because even locally, like even the nurse practitioners and stuff, you have to go through SHA.
Okay. Can you spell?
I'll get that information to you here.
Deanna
Send an
Larson,
email.
yeah.
Well, I was thinking that even if I still go through SHA, I would still need the community consent just because of that data governance piece. And as much as I know that SHA is co-custodian to the data and the EMR, I still want the communities go ahead.
Yeah, but it's not how they did it. Like, so our first, and this is something like, I don't know if you guys know, from municipalities, they have no say in any of this whatsoever. The First Nations do, but the municipalities don't. So I hear what you're saying, but you're not going to get anywhere until you actually deal with SHA. And so, like I said, and then you're gonna have to go through individuals. So it's a bit frustrating. And that's why I was saying, honestly, the way things are set up, it really has eliminated communities completely. I think, really.
That's okay. One day at a time, we'll get
Yeah.
there.
The North is different. That's why I keep saying we need our own health authority, I think.
Yeah.
I'll vote for that. Dr. Udoka, I just wanted to clarify EMR. What's the acronym?
That's the electrical medical records. That's the platform that practitioners use to see patients when they come to the clinic. Yeah.
Yeah, I don't know what the protocol is. I know the Boval Clinic has serves also the English River residents here, so I'm not sure if that data sovereignty is if there's an angle there, but maybe Candace would know that more than I would right now. But being a provincial system, I think the regional health authorities were lot more conducive to community engagement. And that's what's the void. That's what Georgina's feeling. We don't have our community representation at the health authority, and everything is far removed. They're in Regina. The policies are made way wahyo, far away.
Mm,
And here, at least the interpretation of that policy and the potential of establishing a policy was at the community level. It's non-existent now, and the data and information is next to none.
mm. Yeah, but there is a data sovereignty agreement in paper on the SHA side, but in practice, from what I'm hearing and from what I see, it's not enforced. So they have that on their website that they respect indigenous data and all that, and they allow indigenous people to assert their rights to have their data used, but there is no practicality or truth to that statement on the website in practice, and that's what I'm hearing also echoed here in the meeting. So
Yeah.
it's,
And when they say Indigenous people, they're really only talking First Nations people living on First Nations territory.
okay.
And they actually don't, their advisory group, that's who they go to for information. Even though they have nothing, their advisors don't have any information about our north. So like I said, it is really, really bad, like Udoka. It's very bad. It's very disconnected.
Mhm. What
Well,
can be done, like at least on a
I
community
want to
level?
take a Nerf gun and shoot them all. A Nerf gun, like it. It would make
run
me
our own
feel
health
better.
authority.
Oh, it's really sad.
Well,
I
the hard
met,
part, is that they really will not listen to anybody right now. And I don't
yeah.
know, I really don't foresee that even an election, I really don't know that it'll make a difference because people are so, there's enough people in this province that are pro Sask party and they're just everybody's just letting it go and doing whatever. So I don't know that there's, but like I said, I think that's where I think we have to band together. All of us, and then really, like I said, we have to come up with a strategy and really, I think people have to be made aware, and I think we have to come up with a way of dealing with this. But I actually think we have to really decimate what they have now and come up with our own way. That's why I really think that's the only way that's going to make some big change.
Yeah, I think as Georgina reported, I think we're being risk managed as
Yeah.
they're doing the compliance on the municipalities. I think the sovereign situation with First Nations protects them a little bit more, but where the Métis sovereignty falls into place here going forward, we may chart a future for ourselves in that sense. So lots of unknowns, but the potential is there, but the problems are also here. So we have to steer the ship the right way or create our own canoe.
One of the things that Rick, you proposed that we haven't acted on is trying to work out a direct relationship with the federal government, similar to what is done through First Nations. Because the challenge that you run into is that the 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 priority of the SHA is the South. The priority of the hospitals is the South. The priority of the regulatory bodies is the South. The priority of the patients is the South. The priority of the policymakers is the South. And to actually knock on the doors of staff within SHA, they're just trying to survive within this framework. And so they do what they have to survive and benefit personally. They're not interested in communities. The data that you have is right now being restricted. You cannot get data from the EMRs. You can't get data from because there's 5 EMR systems in the province. They can't even talk to one another. You've got the SHA that has developed this AIMS database. I don't know if you heard about AIMS, but it was going to coordinate all the efforts of all these agencies. They turned it on, it crashed. They worked on it for a year, they turned it on, it crashed. They turned it on, now they're saying that you can actually do part of what it is that they set out to do. But the challenge that you run into is the actual people that the patients that are actually accessing the actual health, even accessing my health in Saskatchewan. The challenge is I don't get access to anything. I could go on and I can find out which lab tests I've got or which tests went through, but it's not shareable. I can't do these types of things. I think as what's put forward, I think you're barking up the wrong tree. The problem that we have is advocacy by the northern municipalities is dead. The advocacy of particular types of projects is dead because they're controlling everybody by money. They say, oh, the Friendship Center's just got navigator programs, navigator staff, but it's all conditional on you signing this agreement with SHA that they're going to describe, they have total control all over the information, the funding, you can't go into the hospitals and everything. We know what the problem is. You're not going to turn people around by saying, oh, we're going to collect some more data to show the problem was bad. And as Dr. Veronica keeps saying, no, it's worse than you think because it's not there. The strategy has to be what Rick talked about a long time ago. It's to organize the communities to come forward with, if you want to spend your time on things, look at a map to get the communities getting their own health authority. Who should fund that is the federal government because they have a mandate and a responsibility. I think this problem that we've discussed for 5 years is very simple. We know what the solutions are, but you can't get the ear of the people to even listen because they are all solving their problems. All the provincial government is worried about now is survival. They know they're going to lose 10 seats in this next election. And so what they're doing is they go back to their base and say, what can we do? What can we do? And so they built an addictions facility in Lumsden. But the addiction facility in Lumsden is going to follow the same model that doesn't work in North Battleford. I mean, so big deal. But publicly wise, we do not do a good job of managing communications. I mean, we do not. If you want to help us to develop a communication strategy. We don't have a way of communicating to people so that everybody can know and you can pass on this information. What we are doing is we've got all this information for how long we've been doing this, Rick? For 5-6 years, but we haven't done the 4 years. We haven't done the work of putting it together. As I asked you before, could you put that tapes together with the issues so that we can get a good understanding of the problem to actually put together a strategy we could take forward so that when Rick goes off to Ottawa and Veronica jumps on a plane to Toronto and she meets with these potential funders that come from ISC in Ottawa, that we can get access to money from the National Health Transfer. We're not going to do it from trying to influence the system. So that's my compliment or my suggestion to you is you've got to understand the problem. And right now, with all due respect to your a model and everything like this, you've jumped to a solution without knowing the problem. You don't know what the problem is, and you're trying to say, well, we're going to do a database to actually try to change people with data. That doesn't work in Saskatchewan. I don't care how much data Veronica puts forward about the COVID and the number of people. They don't care. What they're interested in is survival. How do they knock down the financial costs? They're not interested in Georgina's dog problem. They're saying that's not going to affect my vote in Regina or Kindersley or Yorkton. So that's my frustrating comment.
Well, thank you for your kind feedback, Chris. I appreciate that, and it's something that I've had conversations with Candice about this, pulling all the data that this group has had since its inception, and we can work on that. I guess we'll resurrect that again in this meeting as we move forward. Thank you. Appreciate it.
Thank you, Chris. Yeah, and Georgina, I think that's still a challenge for us, is to try and flip this agenda or this solution to the federal issue.
Yeah.
I think that's the model. If we have a model to present or a strategy to present, I think it should be a strategy to the federal government. The provincial government, we see, we have an MLA elected in that area. It hasn't opened doors for our communities. It's still political. We know the previous MLA was NDP. During the pandemic, they wouldn't even let him come to Regina. Like in an emergency response pandemic issue, elected leaders were risk managed. It politically risk. It's as Chris hit the nail. It's very politicized, these policy making. So if there's an opportunity, Georgina, just think about it. Let's see what we can do to strategize to try and get the federal involvement in the north, and maybe that's where we can get some traction. We may need cooperation between First Nations and our municipal governments, but I think to me, that's ammunition for us. It's more support, it's more capacity for our communities. We're all interrelated in some way or another. So health and education and all the regional services, I think we should go. I think it's time.
I think it's time, but again, as long as things don't change, we as a municipality I've been told more than once to stop talking. So it doesn't help much when the majority of the council members are Sask Party supporters, and raising issues has become difficult. And so nobody's working together the way it should be. Things are bad. And I don't know how to make the changes required that is required. But it is what it is, and we still gotta get up tomorrow, and we still gotta work, and we still gotta do our best.
Well, speaking of work, good luck in your new career. As you mentioned, you're onto a new adventure over there as well. So good luck with that.
Thank you.
Okay, going around before we lose everybody, any closing comments or questions anybody has for us? We will schedule again next Wednesday as usual at 1 o'clock. We've talked about changing the time, so do think about that, if we should be strategizing this meeting to a different time or location, different part of the week or different time of the day. But in the meantime, next Wednesday at 1 o'clock, we'll stick with that for now. And if, as Chris said, I know I've brought up the federal issue before, but I think we should start knocking on those federal doors, or at least even the regional minister. I believe it's Randy Bossino out of Edmonton. That's the regional minister that's assigned for Saskatchewan in the cabinet. If we can get an invitation for him to come and join us, it might be a good opportunity to lay some of the issues at their doorstep, or might find solutions from there. If no other questions, I guess in closing, the prayer today would be, we see all this violence erupting. A year ago, as we mentioned, Ukraine was on top of our mind, but now we have the Gaza and potential with Lebanon and the Middle East. It's those children, the elders, the vulnerable. We want to send our prayers to that. So, we pray to the Creator for the elders and the youth that are top of mind, top of our concern in these very turbulent times in our world. So our hearts, our thoughts, and our wishes for the new year is that we find a peaceful, humbling, healthy new year for those children coming into our world, and that we can take care of them and nurture them properly and find a future for them on our beautiful planet, in our little corner of paradise over here. So in the Creator's name, amen.
Thanks,
Thank you
anybody.
very
Take
much.
care. Bye.